Before folks speak, if you could state your name, that would be great.
Absolutely. I'm Seema Asadi. I was really nervous coming in here, but now that I look around and see so many familiar faces, people who trust me, I feel like I can calm down a little bit. Dear members of the Board of Merced County Supervisors, Merced County Board of Supervisors. As some of you know, I'm Dr. Seema Asadi. I've been a community pediatrician in Merced for over 20 years. I am also the product of an in-person public school education from kindergarten through medical school. I have spent many hours over the last 5 months studying, reading, analyzing, going through papers, all related to COVID-19 and how it impacts pediatrics. It is to some degree bold of me to say, but I want you to consider me your local expert on pediatrics and COVID-19. I have done my homework. And this language is a language that I studied. I don't expect many of you did. And the same way I don't understand maybe your language, this is hard stuff to understand. And this pandemic really has challenged even us as scientists and doctors in terms of our normal understanding of disease and disease spread. Sorry, I'm going to try to be quick. As a pediatrician, my role is clear in this community. I am an advocate for children, period. In medicine and science, when I'm deciding with any of you or others on a treatment or recommendation, I am calculating in my head benefit versus risk. No prescription solution or treatment comes without risk. Please hear me. I am not up here to tell you that COVID-19 does not have risks for pediatrics. However, by the way, there is never any such thing as no risk. However, I am here to tell you that when analyzing risk versus benefit, the scientific evidence is mounting that shows that COVID-19 is not a pediatric pandemic. For the most part, kids are not contracting, spreading, or significantly suffering from COVID-19 itself. It can be safely assessed that the risk of COVID-19 in children is significantly less than the academic, social, emotional, mental, physical, and nutritional benefits of in-person school. In fact, in many parts of our countries and others, kids have been in preschools, daycare centers, large centers during significant outbreaks, and they have not had significant problems or contributed to significant problems in the outbreak. Make no mistake, here in the U.S., here in our county, we are failing our children in our response to this pandemic. I am already witnessing the heavy toll that this is taking on our children. Not the virus itself, but our inability as a society to cohesively respond to it and to acknowledge that it even existed. Some children in our community are now faced with hunger, despair, solitary confinement, neglect, abuse, and in some cases, deportation to other countries to avoid the prospect that a parent has to face of leaving their child home in an unsafe environment while they go to harvest our food. I am not talking about refugees in a third world country. I am talking about real kids, real circumstances here in Merced, California, United States of America. We should be very, ashamed of ourselves as a society. We prioritized our reopening in a way that has now left us crippled and no choice but to delay reopening our schools. Months ago, our experts sitting behind me in the health department outlined in great detail the protocols necessary to reopen schools safely. The governor has now outlined protocols, and he has given us parameters with which we can get our county under control and consider restarting based on those metrics.
Doctor, you
I'm
have just a few seconds to.
Okay, I'm sorry. I do want to publicly commend one private school in this town, Our Lady of Mercy School, that from the start has embraced distance learning and is now made every modification possible to their school to meet those protocols. I just want them to be looked at as an example for how to do this and do it correctly. They've even changed their drinking fountains to hand washing stations. I suggest that every adult in a decision-making capacity please put politics aside, work together and to ensure that our schools pre-K through 12 are ready to go as soon as we can meet those metrics. Unfortunately, there are 3 metrics that I also want you to pay attention to: the teen suicide rate, the teen pregnancy rate, and the teen dropout rate. Again, by being in denial about this pandemic, we have now failed our kids. I own that, we must own that, and we must work together to make it better. Thank you. Oh, and if any of you have any questions about the science of this or the pediatric component, as you go on making your decisions, I am ready to answer those questions.
Did you bring a card, doctor? I know we can Google you, but that's okay.
I
Thank you.
literally ran out. Yes, no, those are my husband's cards. I'll get them to you.
Thank you.
Thank you.
Thank you. And I do.
If you're subscribed to the channel already, you might want to check and make sure you're still subscribed so you're notified whenever a new video goes live. And subscribe if you're new. Until next time, this is the gardening snail of Livingston, California, because not every critter is hiding under a rock.